I'm going live.
Got it.
I'll let you know when it's up. It's on.
So we're pleased to continue the conversation on reopening church buildings. And I want to introduce our guest, Dr. Linda Mobula, who is a physician and a professor at the Johns Hopkins School of Medicine, and also has spent many years working on viruses and pandemics, 6 years throughout Africa and Congo, Liberia, Guinea, working on Ebola. She's an Ebola expert, but she's also done a lot of work with Samaritan's Purse and others in disaster relief in the Philippines, in Greece, South Sudan, Mozambique, and Haiti. Dr. Mobula obtained her Bachelor's of Science with honors from the University of Arizona, and then attended medical school at the University of California, San Francisco. She also has a master's degree in public health from the Johns Hopkins Bloomberg School of Public Health, with a concentration in health and crisis and humanitarian assistance. She's done many, many trips as a medical volunteer to Haiti and has worked in primary care clinics in the largest and the poorest slum in Haiti. And she's also served as a medical director in Haiti for Samaritan's Purse, as well as worked as a co-principal investigator for the Gates Ghana Access and Affordability Program. This is a lady who understands and who knows about pandemics, infectious disease, some of the most deadly, and has devoted much of her medical career towards serving in some of the toughest places to do this. And she has a lot to say about the COVID crisis and what we can learn from the Ebola work that she's done. Welcome, Dr. Linda Mobula.
Thank you for having me today.
Thank you. Our second guest is my friend and well-known to many of you, Reverend Matthew Watley. He's a senior pastor of Kingdom Fellowship AME, which is a 5,000 member church that he planted in Silver Spring, Maryland. It's the fourth largest church in the AME denomination, which most of you know is our oldest denomination. He came to that position after having been executive minister of Reed Temple AME, also the DC location of Reed Temple. A third generation preacher, businessman, lecturer, and author. He is an innovative thinker. And I think you're going to be blessed to hear what Reverend Watley can bring to this conversation, not just about reopening, but about how our community engages in church. His church is doing some unusual things for us, but hopefully not so unusual in the future. Kingdom Fellowship owns and operates a 125,000 square foot tower that leases to the Food and Drug Administration. So whenever that new vaccine comes, it's probably going to happen in a building that Reverend Watley's church owns. They've also got other businesses in that tower, including insurance and legal and tech companies. And they have a 12-acre campus where they're doing another major development. This church, Kingdom Fellowship, has thousands who come in person, but they also have thousands more who stream the worship services online each week. As an accomplished writer, Reverend Watley's released his newest book, Ignite, 50 Days of Prayer That Will Change Your Life. And I understand he may have some copies for free distribution, but we also want to support that book, which has been very, very transformative as many people are understanding that they need to get their prayer life in order in this crisis that we're in. He also co-authored a number of books with his father, the Reverend Dr. William D. Watley, who's obviously one of the greatest and one of the princes among our preachers. Dr. Watley, or Reverend Watley, I'm sorry, has a bachelor's in political science and a master's of divinity from Howard University. And he also has an executive master's in leadership from Georgetown University. And he's received his master's in education and human development from George Washington University. He didn't stop there, though. He's currently finishing up his doctorate in ministry at Fuller Theological Seminary. His wife, Shauna, and his beautiful daughter, Alexandra, are probably supporting him at this very moment. But let's welcome Dr. Watley.
Thanks so much, Jeff. Glad to be here and glad to see you doing well. Good to see you as well, Dr. Linda.
Great. So Dr. Linda, Reverend Watley, Reverend Matthew, let's just dive right into this. When we were here before, We heard many things about reopening churches, but things have changed. Of course, we're still in the midst of the crisis of justice in America, and that absolutely interacts with what we're going to be talking about today with health and healthcare, and the fact that the COVID situation has disproportionately affected our community. But let's talk about what's changed. Dr. Linda, what's changed in the last 2 weeks, and where should we be going to get informed and just to stay up to date on what's going on at the state and the city and the federal level related to COVID-19 and the risk factors for the Black community? And I know there's some CDC guidelines. What can you tell us that's new today?
So first of all, I want to point out that there has been an increase in the number of COVID-19 cases in the past 2 weeks. And I think 2 weeks ago, there was Memorial Day weekend, and many states have slowly started reopening. So the states of California, Florida, and Texas have actually seen a very large increase in the number of cases. And as you rightfully mentioned, the unfortunate murder of George Floyd happened about 2 weeks ago, and there have been mass gatherings and protests nationwide, actually worldwide. And with mass gatherings, there is an increase in the risk of transmitting COVID-19. COVID-19 is transmitted via respiratory droplets or aerosols. And so as a result, we will likely see in the next 2 weeks an increase in the number of cases as well. So the Centers for Disease Control, CDC, put out guidelines for communities of faith, churches, primarily to look at how to protect their congregation. And in these guidelines, which you can find online, there are general things such as maintain social distancing, make sure you practice hand hygiene. And what does this mean for the church in particular? I think it's really important for pastors to look at these guidelines, but also to see how they can apply those guidelines to their specific context. What are the resources they have access to regarding numbers of cases in their state? I think there are several resources online. There's the local health department, there's a state health department, and you can find links to those websites on the CDC page. In addition to that, there's a great website called COVID Exit Strategy, which looks at state by state, the number of cases in the past 2 weeks, whether or not there's been an increase or a decrease in the number of cases.
Dr. Linda, can you say that name of that site again, please, that has those incidences?
Sure, it's called covidexitstrategy.com. And you can look at your state in particular to see within the past 2 weeks what the increase has been. For example, Arizona has had an increase of 198% of cases in the past 2 weeks, and the site will tell you that. And it provides information for every single state, the number of testing, individuals that have been tested in the past 2 weeks. So it's a great resource. And I highly recommend that every pastor visit that site, but also look at their local health department website. Why is this important for the Black community? Number one, based on studies in the US and in other countries actually, Blacks are at increased risk for contracting COVID-19, but also dying of COVID-19. And in the United States in particular, what we've seen is that when you compare Black counties to white counties, the risk of actually getting COVID is 3 times higher. The risk of death is 6 times higher. And this is due to multiple reasons. Number one, there's a larger burden of chronic diseases such as diabetes, hypertension, and cardiovascular disease within the Black community compared to the white community. There is a larger number of Blacks that are doing essential services. So they're out working, they've been out compared to other ethnicities. And you can go on and on and on in terms of insurance coverage, lower number of testing rates among Blacks, access to care, and really highlighting health disparities and inequities that have really been exposed through this COVID-19 crisis. Now back to the church. What can the church do practically? And these are things like preventing people from using offering plates when you're getting your tithes and offering, right? And having an electronic system, potentially not having the children's ministry. In terms of choirs and worship teams, there was another study that actually demonstrated that by singing, you actually generate more viral particles. There were about 30 people that got infected in the state of Washington in March by just attending a choir practice. 30 out of 132 people approximately, and that's pretty high. So in addition to potentially distributing masks, there are a lot of individuals that can contract COVID-19 by being in direct contact or in close proximity to somebody who doesn't have any symptoms. We don't know the exact percentage of individuals that have asymptomatic or pre-symptomatic transmission. Right now it's estimated at about 44%, meaning that you can get COVID-19 from somebody who has no symptoms. Therefore, it's very important, I think, to wear a mask. There's a study that just came out of Germany this week showing that wearing masks reduces transmission by about 40%. And so these are little things that can be put into practice, and I'm going to repeat them. Using an electronic system for tithes and offerings, not having an offering plate, reducing the number of individuals within the church building at a single time in order to maintain social distancing practices. If your church does not have enough room to maintain social distancing practices, maybe you should have people rotating, 20 to 30, 40 people coming at a time based on the amount of space you have in your church. Making sure that everyone is washing their hands, because as you sneeze, you have virus particles that can cover your hand. You shake somebody else's hand and you're able to transmit it that way. So no hugging, no laying on of hands. I think those are things that are very, very, very important to focus on.
Thank you so much, Dr. Linda. And I want to come back to this issue of why we are more vulnerable to this, because some people want to make it our fault. And I know that one of your areas of expertise, you and your mentors have been in this area, health disparities, has sort of set us up to be more vulnerable. And again, I recognize that we're going to be talking about lots of behaviors where we can do something about it, but I can't do anything about it if I don't have a clinic in my community where I can get tested. Let's turn to Reverend Watley. Reverend Watley, let's just take what she just said. I mean, she just ruled out offering plates, a number of different things. Should corporate worship be the first stage of our reopening? And tell us what you've done at your church.
Sure, that's a great question. I appreciate the frame because I'm a big believer in everyone pastoring their own church versus through social media trying to pastor everyone else's. But I'll tell you what we're doing at ours. Our plan for reopening, and we're in no rush, is to start with what we're calling a soft opening, where we will invite a smaller number of persons than what our congregation can accommodate under what the governor is expected to put out, or even the CDC guidelines in terms of capacity for our square footage. We're going to start with a smaller group just for the tapings that we're doing to produce our digital service. That does a number of things for us that we think are important. One, it allows folks to get in who really have a burning desire to get back into church, and that's important. Number two, it allows me to get to preach to people rather than just to empty seats. I think that's important. Number three, it allows us to be able to tweak our system. So we're in the process of doing all the things that Dr. Linda mentioned and others in terms of crowd management, sanitizing the building, providing sanitizing stations. We're even looking at providing thermos to check people's temperature before they come in. We feel it as a service because we don't think anyone would attempt to try to come if they're not feeling well. But if they're not aware, then we can inform them. There will also be a registration process so that if anyone does become sick, we already already have the information for contact tracing. But it also will allow us to be able to show people online wearing masks in the sanctuary to help to normalize that. And then fifth and finally, and most importantly for me, because we think we found something new during the season in terms of our online presence. We were already streaming our 3 services before, but really it was voyeuristic streaming. So it's just turn the camera on and whatever was happening in the sanctuary, that's what you saw. We've now created a more customized digital experience specifically for the online audience. We won't go away from that. So even when we do go back to live worship on Sunday morning, we will continue to pre-produce a service that's designed specifically for the online audience. We learned that it's different being at home watching church than being physically there. It feels much longer when you're in your family room because you're not a captive audience. And so we've shortened the time. We've added additional pre-production packages that you wouldn't be able to do necessarily as well live. And so we think that we've happened upon a great opportunity to actually reach more people online while we're able to sort of slowly walk into the physical in-person worship. And as we get that experience, we'll learn from that, and then we'll be ready to do Sunday. The other thing it does is because we tape before Sunday, that will give us more than adequate time to sanitize the entire building versus the 30 minutes that we used to have in between our live services, which would not be nearly enough time to properly sanitize the building before allowing other congregants in. So we think that we have a strategic, staged approach that takes into account the science, but also the mission of the church. We won't be having children's church. We're offering resources online, but we're also cognizant that we're in a larger context, that it's not just the quote unquote church industry, it's the hospitality industry, it's the educational industry. So what happens in the fall when it's time to go back to school? And we know as African Americans that school is much more than just a place to learn. It's a safe place. It's a place for for consistent food and nutrition. And so if our schools can't open because of COVID, there are any number of other healthcare issues that then are triggered by children who can't get back to school, who don't have computers to telework or to telelearn like other children do. So we're trying to take a balanced approach and a larger conversation that's happening in our country. There's an amazing book called American Nations that talks about how our country is actually comprised of 11 separate nations that have very disparate values, economies, languages, and such. And that's why I think you've seen the country respond in very different ways to the crisis. Some folks act like it doesn't exist. Some folks are absolutely terrified as if this is the only life they're going to live. And a lot of folks are falling in between. So I think one of the responsibilities of the church is to lead that conversation and to lead the effort to try to make sense of what are difficult choices. Because every time you make a decision on this side, it has unintended consequences that impact lives. So we're trying to be a part of that conversation.
So I'm going to drill down on 2 things you said, and you said quite a few things that obviously could be unpacked in a lot more time. But if we think about the safety, the science, and the spirit, you seem to be, and I just want to hear you tell us again, you're redefining what we experience as church as almost of necessity requiring a digital streamed version, or however the digital is presented, as well as the geophysical. And you made a kind of an equivalence between the two. You were doing it before, now you're doing it because you have to, you must. How should a pastor be thinking about what he does in his stream versus what he did in the geophysical space?
Well, sure. So it's just a different dynamic. So for instance, when we first started, we were doing church like we normally did. And once I sat at home with my family in the family room, I realized that exhorting folks to praise and worship for 5 minutes before you start the song is great in a traditional Black church. But when you're sitting in the family room, it's a little awkward. And so we've started to shift the way that we do praise and worship. Here's the other thing, Jeff, about digital ministry. We're not just counting the views on Sunday. We actually track our Zoom engagements throughout the week. So we have 1,000 people throughout the week that are engaging through one Zoom or another because all of our ministries are now meeting online. And so what we're learning is that about digital ministries, it's not about the number of views, it's about the depth of engagement. because people will view your content like they view Netflix or anything else. And now you're seeing even Netflix now has the capacity to have chat around viewing, because it's about having a deeper engagement experience. We're still social animals. And so we're trying to supplement that social need digitally, which is all about engagement. Theologically, we know that evangelism can happen through content, which is the stuff that you produce through UMI, but discipleship has to happen in community. And so digitally, we're creating community, whereas before we were just looking more at an analog digital presentation, which did not have the depth and feel that now we're developing. You also mentioned pre-recording. Why did you shift to that? You alluded to it, but I'd like to hear you explicitly talk about that. Sure. So one of the strategic decisions we made as we moved into this was to recognize that many of our operational costs would go down. We're not cleaning the building as often because nobody's in it, and other expenses. We decided to reinvest those dollars in outreach. So now I just had an article come out today. We're now calling ourselves a multi-site church, not because we offer services in multiple campuses, but because we're feeding people in 4 different campuses across 2 counties. So because we're now shifting, we're devoted our budget to outreach, to missions overseas, but then thirdly to digital. So I hired a social media strategist, because having presence on social media means more than just having an account. So she's helping us to understand the analytics, the way searches work, how to use the metadata, how to test market to see what has impact and what doesn't, so that when you buy ads, you're buying the right time and identifying the right people who are most likely to connect. And then third was we hired a producer, member of our church who has her own production company, who's done work in movies and at the White House and all kinds of things. We brought her on because we recognize all of us have an expectation, an unconscious expectation about the quality of experience we have when we view something online. And so because we've been watching multi-million-dollar pictures for years, when we turn to church and there's one camera that's poorly mounted with bad lighting and sketchy sound, that is offensive to us in ways that we don't even recognize. And so we recognize that we need to step up our game, and pre-recording allows us the flexibility to be able to put and package it together in ways that we just couldn't if we were just going live. Got it. Dr. Linda, you just heard a pastor talk about how he is responding to this crisis. One of the things that he mentioned that got my attention was cleaning and cleaning in between services. How important is that on the list of reopening and responding? And do you have any insights that maybe we can glean from your work with Ebola or other highly infectious diseases and the whole matter of cleaning? How should we think about that?
First of all, I'm very impressed with what Reverend Watley has done. And I think it's extremely critical to clean between services. And I'm going to say why. First of all, coronavirus can basically be spread by respiratory droplets. And so it can be maintained on surfaces for hours based on some of the data that's coming from studies. And so if you want to limit transmission from one person to the next, it's extremely important, and I'm going to repeat this again, that you clean between services. Clean surfaces, make sure that everybody's washing their hands constantly. So you want to make sure that you have water and soap available. In churches in Africa, for example, what I've seen is they actually have hand washing stations before you enter the church. And everybody is required to wash their hands before they enter the church. You mentioned screening as well. Buying thermometers, thermoflashes, and basically checking everyone's temperature before they enter the church. Probably in addition to that, I think it's really important to identify a point of contact. Who is the individual within the church who is going to be in contact with the health department, for example, if someone does have a fever? If someone gets sick at the church, how do you refer them to the health department or to local public health authorities? That's really important as well. But also education. What I've seen in the Congo and in West Africa during the Ebola outbreaks is that the church has played a very important role in educating communities. Our pastors are people that we trust, and there is a lot of information about COVID-19 that's circulating right now. And so as a pastor, as an elder, if you are able to communicate to your congregation about COVID-19 in order to dissipate some of this, some of the rumors, the fear and mistrust, I think that's going to be important as well. So not just putting into place public health measures such as hygiene, so cleaning, hand washing, screening, but also communicating with your congregation about the disease itself, how it's transmitted, how you can protect yourself.
So you seem to be suggesting, and maybe you want to suggest this explicitly, that maybe in the Congo and some of the places where they had to deal with Ebola, they're more strategically aligned than maybe we are here in the US?
I think the Congo and these other places might have a little bit more experience dealing with outbreaks than the US does. What I've seen in national plans, for example, is a clear strategy on risk communication that includes religious leaders, pastors, and priests for the Catholic faith, for example. And I've seen very targeted strategies involving pastors, getting them more involved in, Ebola is different from COVID-19 in that, how you bury somebody really matters. So, isolation is extremely difficult. And how do you incorporate the church strategically in your response plan is something that other countries in Africa, I think, have done well. I remember in the Congo last year, there was a pastor who sadly died of Ebola because he laid hands on multiple members of his congregation. And so the response team, the national response team, went to various churches and they worked with pastors to ensure that they would no longer lay hands on individuals, on the members of their congregation, that they would provide communication. Posters about Ebola were actually placed on the walls of the church. And this is something the CDC guidelines suggest as well, including more information about COVID-19 within the church. So you're not just preaching the word of God, but you're also teaching your congregation how to protect themselves, because I think that's part of what God wants us to do. Our body is the temple of the Holy Spirit. And I think we have an obligation to take care of ourselves physically and spiritually.
Got it. Now, one of the things that we're trying to do in terms of taking care of ourselves right now is respond to some of this injustice that has led to massive protests around the country. And in many instances, faith leaders are going to actually lead some of these activities. What should we be thinking about as we enter this reopening process with protests going on that are amassing, in some instances, thousands of people? Is there a better or safe way to do it?
There is definitely a safer way to do it. And I talked about wearing masks to protect yourself. Sometimes it's not possible to maintain, 6 feet distance between you and the person that's participating in a protest. But if at all means possible, I would actually recommend that you maintain that social distance when you're actually protesting. Wearing a mask, making sure you have hand sanitizer with you. And for those that do participate in protests, as soon as you develop symptoms, make sure that you access your healthcare provider, that you actually get tested. And I think we've seen a couple of members of the National Guard become positive with COVID-19 in Washington, D.C., meaning there was likely COVID-19 within the individuals that actually participated in the protest. So this is just a reminder again, and I want to reiterate this over and over and over again. If you are Black, not to genetic factors, you are at increased risk of dying of COVID because of the increased prevalence of certain chronic conditions such as diabetes and hypertension. And so you want to make sure that you protect yourself. In addition to that, according to the studies, men and individuals that are greater than 65 years of age are also at increased risk of dying from COVID. And so know what your risk is when you participate in these gatherings and protests. I think it's important to participate in a protest, don't get me wrong, but I think it's also important to protect yourself while you're doing that.
Got it. So Reverend Watley, one response to injustice is protest, certainly an important one and a critical one. But there are other ways that the faith community and churches in particular can respond and that's through community development activities and some of the things that your church has been really on the forefront and a leader of. Can you connect the dots for us between economic and community development activities in the faith community and the churches specifically, and the issues of racial disparities? How have you approached that? Give us a theology of community development as you see it.
Sure. So we know about the interlocking spheres of oppression, that how one issue does not stay cloistered in its little quarter, but it overlaps with others. So we're seeing this as a perfect storm right now with COVID. COVID is impacting, as Dr. Linda just indicated, the rates of morbidity and mortality, African Americans disproportionate. We also know that the rates of poverty, lack of access to quality health care are also disproportionate to African Americans, and that's because of systemic racism, which is a justice issue, which is a kingdom issue. And so we see these as all coming together because the pandemic triggered the global recession, which will soon be a depression, but they're scared to say the D word yet. So they just said the R word. They'll get to the D word soon. And we know that it took us over 10 years to add back the jobs that we lost in April from the last recession. And so we know this is going to be a protracted recovery process, which is going to also require not simply folks going back to work, but folks are going to discover that the jobs they want to go back to no longer exist. So I have a member who's high up in the hospitality industry who's explained to me how hotels are going to work, that now they're developing apps that you no longer have a front desk experience. You use your app that tells you the room number, and then you go and it actually unlocks the door to the room. So then you don't have to employ as many people at the front desk because they're there sort of now only for emergency. That now your room is not going to be clean like it used to be clean. Now you'll get free clean towels and linens dropped at your door, but no longer is somebody going in where you have to employ as many people if people are not cleaning those rooms. Same thing, they're dropping off food for room service. So now you have a sector of people, since we were a service society, that now when service can't happen as it used to, are now displaced from employment. And so the church has always served as a leader in empowering our people. I often make the distinction between the Black church and other churches, that white churches, majority churches, have the capacity and, quite frankly, the luxury to focus on faith almost exclusively. The Black churches never had that luxury. We have to educate, we have to do healthcare, we have to do economic empowerment, we have to do it all because we're the only viable institution that we have. And so I actually think that this issue will actually cause a revival of the Black church, because people will come to appreciate who we are and what we've been doing the entire time. And so I think that there are any number of opportunities. We certainly have sought to support our ministry outside of the offering plate for some time, because you recognize that the greater capacity we have in terms of our finances, the more impact we can have in terms of doing kingdom work. And so the second campus that we bought, we're now in the process. God has us building a new church in the middle of a pandemic and recession. So we actually will break ground in August on a $45 million project, because God has a sense of humor. But as we're moving forward in this, that's just for one of the buildings. The other building on our site, we're going to look to, we're actually in the process now of repositioning, both for socioeconomic training as well as housing, because we recognize that there's going to be a huge housing shift. And we're even now bracing us on a phone call before jumping on this Zoom with a colleague, because July 15th in Maryland and other states, the courts will open back up, and a raft of eviction cases are going to hit because the 3-month period will be over. And we also know that's going to disproportionately affect us too. So we're now trying to brace and figure out how to prepare for those who are going to be affected and impacted by that. So the church has always, but now more than ever, it's going to have to be creative and trying to help people navigate very choppy economic and employment waters.
Thank you for that. And thank you for stretching the vision of just what the role of the church can and should be as we move forward. These disparities do extend to healthcare specifically, though. And Dr. Linda, I know you're an expert on that and your mentor. How have these conditions, these economic conditions, affected us in the healthcare arena and made us more vulnerable? It seems often that people want to blame us for the fact that we're more susceptible to it, but what's the cause behind the cause? If we were to do a 5 whys analysis, why are we more susceptible to these kinds of diseases and incidences? With us, Dr. Linda?
I think the percentage of individuals that are uninsured is much higher among African Americans. And in addition to that, access to care becomes a challenge. And so when you have diabetes or you have heart disease and you can't access a primary care physician to make sure that your disease is well controlled, that increases your risk. So it's not just because you're Black that you have increased disparities. I think it's because of the fact that there is systemic racism. There aren't as many opportunities in terms of employment, jobs. So it's really, the system. I encourage everybody to read this great article called Herd Immunity that was written by Dr. Lisa Cooper, who's a professor at Johns Hopkins and one of my mentors, that outlines some of these disparities that exist. When a Black child is born, the chances that this child lives is much lower. You have, in terms of age, people die at a younger age as well. And so it's not genetic necessarily, but they're actually, structural, there are a lot of structural reasons that exist to explain why we have these health disparities. And you see them across the board. I mentioned hypertension, diabetes, and cardiovascular disease, but in terms of kidney disease, complications from these conditions as well, maternal mortality. We're seeing a lot of Black women die during childbirth. So there's a large range of structural reasons that can explain these disparities and inequities in health. And there's an entire field that's been devoted to this. Multiple individuals have devoted their careers to this. And I'm glad that this is being highlighted. It's unfortunate that the system is the way it is, but it's important to address these disparities in order to improve health outcomes overall. Even in terms of transplantation, it's much more difficult for someone who's Black to actually have access to a kidney transplant compared to someone who's white. So you have inequities in terms of transplantation, in terms of testing for COVID. And it's the way that, honestly, that we're trained in medical school. So I think there's also a lot of issues with how physicians of other ethnic groups perceive Blacks. So sickle cell disease, if you have sickle cell disease and you go to a hospital to seek care, you are more likely to be, providers will more likely think that you're actually seeking drugs as opposed to actually having legitimate pain for sickle cell disease. And there have been multiple studies that have demonstrated this. So this is deeply rooted in the healthcare system and needs to change as well.
Absolutely. And of course, across hundreds of years and multiple generations. That's Lisa Cooper, and her article is in the Journal of the American Medical Association on herd immunity. It's not our fault, at least not totally, because there are just things that we're suffering from. Well, let's bring it back down to ground level. So thinking about leaders like Reverend Watley and other leaders in our church, should staff and leaders be tested? And how regularly? And what about screening of church members? And I'd love to hear your answer on that. And I'd love to hear Pastor Watley respond to what he's going to do based on what you say.
So I just want to start off by telling you about the two tests that are available for COVID-19.
Okay.
An antibody test, and there's a viral test. So the viral test is best used in the process of an acute infection. So when you first develop an infection, because the antibodies basically develop 1 to 3 weeks after you get infected. That said, testing availability has been an issue nationwide, worldwide. And to answer your question on whether or not pastors should be tested, there are different positions on this. And my personal view is if you know that you've been exposed to COVID or you have symptoms, please go get tested. If you have not been exposed to an individual who has COVID, and that's sometimes difficult because people don't have symptoms, but you've been maintaining social distancing, you've been wearing a mask, I wouldn't recommend necessarily getting tested. However, if you attend a protest, you've been exposed to a mass gathering, then I would recommend testing. The challenge with testing is that there are false negatives and there are false positives. So we haven't really perfected this system yet. Antibody testing isn't that great. It isn't that beneficial because of the false negatives and false positives as well. So my recommendation would be look at your level of risk in order to determine whether you should get tested. Should you get tested repeatedly? I would say no. But if you do know that you are at increased risk due to exposure, absolutely get tested.
Now, do you get your test results right away, or is there a delay? Can you comment on that?
There is a delay.
How long?
Typically, it's about 24 hours minimum. So it does take some time. What I've seen at the hospital when I've treated patients is that while we're waiting for the test results to come back, if we think that that individual has a high likelihood that they have COVID, looking at their X-ray, looking at their symptoms, they do get admitted to the hospital while we're waiting for those test results to come back. But it typically takes about 24 hours to get test results back.
So Reverend Watley, you got a big church. What's your plan for testing leaders and staff members and others? Or do you have a plan in that regard?
No, I don't have a plan. I think that the onus does fall on the individual. And I think that as a leader of an institution, I want to respect people's individual rights and freedoms and choices. However, we are looking at trying to become a community testing site because, again, we recognize that disproportionately this affects us. And so we want to provide as a resource to the congregation and the community for those who desire that to know where they can get it. So we're actually working along those lines right now. I can tell you right now, one of the things that I really want to get out for colleagues in ministry is maybe an unseen risk factor that many folks don't seem to be considering, which is the use of the microphone. So I can tell you when I record, I walk into the church, go into my office, put my things down, take my microphone out of my bag, go to the sanctuary where a new battery and disinfecting cloth is waiting for me. I put the new battery in, clean the microphone, go to the podium that has been cleaned. I wave at the staff, I preach, I wave at the staff, I leave and put my microphone back in my bag and leave the church. So what I've seen, particularly with funerals and other things, is that people are wearing masks, they're wearing gloves, they're doing everything, and then they're going to the number one place in the building where droplets are, which is on the microphone.
And
so one of the things that we have to look at, I think, is as we travel, do you travel with your microphone, or is there a way to sort of certify a protocol for the cleaning and the sanitation of microphones and other instruments?
That is very, very, very good information. Talk about the things like distancing. How far apart do you intend to seat people, and how will you be literally using tape measures for 6 feet distance or 12 feet, or how much time do you want to dedicate to that kind of work?
Yeah, so the great part is we don't actually have fixed pews, so it's much easier for us to change and sort of maneuver our seating because, again, we're starting with the soft opening. Then we'll be able to control we'll control the number for all the services ultimately. But with the soft opening, we'll start with a lower number. We will be seating family groups together because they pretty much already have been exposed to whatever is going on in the house. And then singles and other individuals will be set. So picture a group of family of 3 sitting side by side on a row, and then picture 6 feet away from them on either side, the next person, individual or family being seated. And then picture probably the next row and a half behind another row of chairs with the same configuration. So again, my expectation is that most of our folks are going to stay online for a good while, and we will trickle back. And so I'm not in a rush. I'm not getting any pressure to open up. But I think that as we're seeing through the summer, both with the protest as well as with folks just being inside for the last 3 months and the weather breaking and want to go to the beach, wanting to get back to the mall, wanting to go back to restaurants, and then vacationing, and then the fall. What I think is going to happen, quite frankly, is that risk is going to be normalized, that people are going to learn how to, as best they can, practice social distancing and other tools, but I think life is going to go on in a different way. But I do think life is going to go on because there's some things that we just can't get around and get over. People have to start getting on planes if their businesses are going to survive. And so those kind of choices, I think one of the challenges is, quite frankly, that the church has become the face of like the COVID crisis. And I'm not sure that the science backs that up totally. We know that there can be super spreaders anywhere. But I think that it's important, since we have the attention of the world, to model what it looks like to be responsible and to try to strike a healthy balance between risk and life, because you have to have both. My family has started to associate more. We started off 3 months ago. My wife's parents would come by and they would literally stop in the driveway. We'd wave and say hi, and they'd go back home. And after 3 or 4 months, we said, well, you know what? Y'all haven't been anywhere. We haven't been anywhere. We're going to have dinner together. Because at some point, if I can't see my family, that's a part of life. What life am I living? So I think that those kinds of instances are going to happen more and more over time. I'll say this and I'll stop bullying the mic. When we first heard 2,000 deaths, all of us stopped what we were doing and sat down. When we passed 100,000 deaths as a nation, no one blinked an eye. The human capacity to adapt is our greatest strength and our greatest weakness. And we're praying that we can help to lead people in a way of wisdom as we adapt to new realities.
Got it. Dr. Linda, we're coming to the end, but he has been focusing on some very, very practical and very important steps that he's taken in his church and that others will also need to consider, whether they reopen slowly or whether they reopen quickly. Can you comment on his measures on social distancing inside the buildings and what kinds of things that should become a part of this new normal?
And once again, I think you've done an amazing job, Reverend Watley. And I think other churches and other pastors should really model what they're going to do based on what you've done. I think in terms of social distancing, seating within the church should be, you should be very, very careful. People should not be sitting close to one another. Try to maintain 6 feet between 2 individuals. Don't use hymnals. Try to project lyrics or send lyrics to somebody's cell phone. You can do that very easily so they can read from their own cell phone. I had mentioned an offering plate. Do not pass an offering plate. Mentioned singing. The worship team, the choir should be very careful with their microphones because as you're speaking, as you're singing, you can basically shed, right? So these respiratory droplets and viral shedding occurs when you're singing and speaking. And so disinfecting microphones is extremely important. Disinfecting musical instruments as well, if you're going to be using them, is extremely important as well. So not just social distancing, these hygienic measures such as disinfection, which I've mentioned before, maybe potentially thinking about individuals that are at increased risk. So those are greater than 65, those that have these comorbidities, maybe making sure that those individuals actually stay at home. I know it's hard to be home. It's hard to be isolated during a crisis. And sometimes we gain strength when we're fellowshipping with the saints. But making sure that these individuals that are at increased risk are at home and making sure that you communicate with them on a regular basis. Phone calls, potentially visits, distributing masks, including that in your budget. For those individuals who can't afford to buy masks, having the church distribute masks to the congregation. Thinking about other programs as well. As you mentioned, I think food deserts exist, making sure that people have enough food to eat. And I think the concept of the church does not uniquely consist of gathering within a building. I think church consists of loving one another, of serving one another. And so if you can make sure that your congregation has access to food, that your congregation is doing okay economically and trying to serve and trying to help them. And I loved the fact that you mentioned that your budget has kind of shifted, right? You're not necessarily just looking at focusing on, paying rent or this or that, but then you can actually focus on missions and maybe visiting individuals by maintaining social distancing to uplift their spirits, praying for one another by calling them, and having digital services as well, as you had mentioned, to really try to reduce the risk. Because as we're reopening, people will try to normalize this
Sure.
outbreak. We've seen that with Memorial Day. We're seeing that with the protests and with mass gatherings, and it's going to happen more and more. This disease is going to be with us for a long time.
It's going
We're
to
not
be with us for a long time. Okay, we hear you loud and clearly, which does mean then we do need to get a read on what's going on with our congregations. And we at Urban Ministries Incorporated, UMI, we are recommending congregational surveys. We have an instrument that we've developed with the Barna organization, and you can get more information on that on our website and also following this. But let me just get a final takeaway from you, Reverend Watley.
Yeah.
What else do you want to share? Go ahead.
Yeah, you just said something that's really important. The surveys are great. A lot of people are doing them. We're going to do a survey. We're going to do it after we educate our people on our plan. Because
Okay.
the suspicion is if I put a survey out now without telling people what the plan is, then they're forced to imagine for themselves what the level of safety is, and it'll make a determination out of ignorance versus information. So we want to empower them first, then we want to survey to get their sense. And I just wanted to thank you for the opportunity. And I wanted to mention one more time that during this season of pandemic, I've made my book available that you mentioned earlier, Ignite, because I think people need to pray, and I'm making it available to individuals and churches. So if anybody wants to take advantage of it, all they have to do is text the word Ignite 2020 to 313131, and they can download a copy for themselves. You can do it for your church. I just want to be a blessing to as many people as possible during this season.
Ignite, 50 days of prayer that will change your life. Thank you so much, Reverend Watley. Thank you, Dr. Linda Mobula. And for all of us, spirit-led, responsible return requires making sure that we take the science seriously, as well as the things that affect our community. God bless you all.